we started a very massive maternal and anemia control program, and again in tribal area. So when we were doing this anemia control program, we realized that food security is also one of the concern. Whenever private sector shows a system that shows good work, the government is quick to catch up and there's an improvement. So it has a cascading effect and immediately it is taken up by the government.
Today we have with us Ms. Archana Joshi, Director at Deepak Foundation. Ms. Joshi joined the foundation in 2005 and has been responsible for designing and implementing the corporate social responsibility of not only the Deepak Group of Companies, but for various other corporates across the country. Her expertise is in the areas of designing projects aimed at achieving sustainable development goals and developing systems for monitoring and evaluation in the areas of population, health, and nutrition. Thank you so much for joining us, Ms. Joshi.
Thank you, Yamini.
So, ma'am, let's begin by understanding a little bit about your professional journey and how you got started with Deepak Foundation.
Okay, my journey began with teaching in women's institution before I got married, and then afterwards, after coming to Gujarat, again I was associated with the Ford Foundation project, which was focused on maternal and child health. It was linkages between women's workload and child development. Right. And from that project onwards, I joined ORG, Operations Research Group, in 1991 because the same project was being implemented, which I was handling before. And there I worked for over 14 years as a researcher. So I was a social researcher with them, and I worked, and that time used to evaluate a lot of government programs as well as international programs that we used to evaluate. Right. And so it was a consultancy research. From then onwards, my journey began with Deepak Foundation, which was basically to handle a large-scale project on maternal and child care with the objective of reducing infant and maternal mortality, which was a big project at that time. So that's how I joined Deepak Foundation in 2005 at a very nascent stage of this project, which later became a hallmark for the institution.
Right. That's wonderful, ma'am. And, seeing as you've been with the foundation for over, 15 years now, tell us a little bit about the vision that the foundation began with and why health and nutrition specifically were identified as priority areas.
Okay. The vision of the foundation was very clear. It was women empowerment. Right. And the goals at that time, was the beginning was on maternal and child health. It's such a coincidence that a maternal and child health facility was set up in 1982 with the objective of promoting institutional deliveries. Because our chairman and the promoter of Deepak Group of Companies, he saw a delivery being conducted in a bullock cart. And at that time, the nearest free of cost facility was about 40 to 50 kilometers away. And so the bullock cart obviously will not reach on time, and she delivered, and he felt that there is a need to do something. At that time, the government was attracting a lot of industrialists to set up a plant and industrial with the aim of promoting industrial development in Gujarat. And so a lot of business people had set up their plants and industrial unit in Andesari GIDC area. And this is how the story of setting up of a very small 15-bedded maternal and child care hospital was constructed. And though the hospital was constructed, but at that time, nobody would come to conduct deliveries because mostly deliveries were conducted at home. And moreover, the population surrounding that area belonged to Darbar communities where women would not step out. And so women and empowerment and maternal and child health was the genesis of Deepak Foundation.
Right, right. That's a wonderful story and origin of the foundation, and it kind of really, embodies that one aha moment that you have, and then that sets the course for what you do. So, walk us through your really unique approach, which I've seen is bringing together nutrition, food security, livelihood, and women empowerment, like you mentioned,
Yeah.
especially with your
Yes.
Paripurna project.
Yeah. So coming to Paripurna project, see, as we scaled up our operations from, a small community of about 50,000, we took up a very large scale public-private partnership project with the Department of Health and Family Welfare, Government of Gujarat. And it was, I think, one of the first PPP model that included about 2 million rural population with a very focused goal of reducing infant and maternal mortality. So from 50,000 population, we moved on to 2 million. While we were doing this project, we found that despite referring cases for promoting institutional delivery to government facilities and private facilities, women were still dying. And one of the underlying causes was anemia. They were severely anemic. And we started our project from the tribal area of Baroda district. So Chota Udaipur district at that time was part of Baroda district. And that was the most remote part of Baroda district. And which was about 100 to 130 kilometers away from the nearest functional health facility, which was Baroda District Hospital. So by the time women would get referred in complicated cases, they would die in our vehicles. And we realized many of them who came for delivery were having very, very low hemoglobin level, which was just about for them to survive. And then we started a very massive maternal and anemia control program, and again in tribal area. So when we were doing this anemia control program, we realized that food security is also one of the concern. Now the area is so rich in terms of production of all types of pulses, be it pigeon pea or chickpea or green gram, all sorts of legumes were being produced here, but they were not processed into dal. And these legumes used to be sold in the market at a very low cost. So they were, though they were producing high protein diet, and also this area was lush green, women were still suffering, and the communities were still suffering of not only nutritional anemia but also sickle cell anemia.
Okay.
And because of banana cultivation, tapeworm infestation was there, and because of water stagnation, malaria was also there. So combined with this, socio-demographic and ecological milieu, a lot of women and the community suffered, had anemia. And we made this presentation to the government. And the second thing we realized that the drudgery for women was very high. These women worked as heavy workers in the field, and in terms of their intake, they were taking maize rotla or maize roti with either brinjal and brinjal and potato vegetables, or the dinner used to be rice and dal or khichdi. This was their main staple diet. Now, maize, as you know, is an iron inhibitor, and so it again takes them back to, again creating a situation for anemia. Second thing was with the dairy, development happening, a lot of milk and other protein food which women could have consumed in their daily diet started being sold for cash income. Okay. So, and third, as I said, was high drudgery level, and no food intake made them very weak, undernourished, and underweight. So we thought that it is very important that while we in the urban area have all labor-saving devices and largely enjoy a sedentary lifestyle, they have nothing. They are heavy workers, their diet is inadequate, and they do not have any labor-saving devices. So that made us realize that we need to do something for them to save their drudgery. And so instant khichdi was a product we thought of, which was culturally accepted.
Right.
So we thought of having not only engaging women in processing pulses to get dal, which is easily available and digestible by young children, adult and adolescent. This byproduct of processing dal, which is called tukri dal, can be used in making khichdi. So we tied up with the food technology partner to develop a product, instant khichdi. We set up a plant. We won this innovation by Department of Science and Technology.
Right. I think that's such a wonderful idea, because at the end of the day, khichdi is just such a simple meal, but it's turning out to be a source of empowerment, a source of security and livelihood for so many of these women. And that's a great initiative, ma'am. And
Thank you.
let's talk a little bit about your experience working with women, and especially tribal women. Can you share some learnings or experiences that you've had working with this population over the years?
See, one thing we learned that the income generating opportunities for these women was low. So when we were working on health aspect of providing emergency transport services, because that was one major impediment which did not allow women to go to the nearest functional health facility for delivery. So we started with emergency transport network much before 108 services started, and we were charging them 2 rupees per kilometer. My first learning was, even when they had no money and they were very poor and we would give them a waiver, they would find us and give the money back. And some of the elected bodies, members of elected units there, or people those who are well off, they would demand our emergency transport services but would not pay. So one thing is the honesty of these people, poor people, and they were willing to pay for the services. So that was my learning, that for good this thing, they had that. You didn't have to ask them for it. So they're very, very trusting people. Second learning was that, deprived of livelihood opportunities, the migration was one of the biggest challenges. So post-harvesting season, the entire household would migrate. And that was also, not only they led to exploitation of women, they would come back with problems like HIV, AIDS. They were not included in the social security programs of the government because they were half the year they were away. They could not take benefit of so many schemes. One of the basic thing to get the benefit of Janani Suraksha Yojana is that you should register in the antenatal program of the government as early as possible, by 3 months. But they would be migrating out, so they miss out on that. Yeah. Similarly, in terms of maternal and infant death, we felt very sad that these documents were severely underreported. This, we did a validation study and found that nearly more, I would say half the infant and maternal deaths were not recorded. So the biggest learning was that our vital registration system so poor. And second is that the government service statistics needs great improvement, because there's a very big dearth of actual reporting and correct reporting. So our health monitoring systems and our service statistics needs to improve a lot to be able to give them good quality services. So this was one of the learnings from the project. And the third learning was that whenever private sector shows a system that shows good work, the government is quick to catch up and there's an improvement. So it has a cascading effect, and immediately it is taken up by the government. So that was one very satisfying thing, that many of the models that we created was replicated in in other part of the state. So this was very satisfying.
That's you've shared some very important points with us about migration and about reporting, because these are real field level issues which, when you work within these communities, you kind of get an idea of what the challenge is, because a nutrition approach is never one size fits all. Every community has its own unique challenges, its own conventions, and the part about private sector is also very important. And that is what we are trying to do at Impact for Nutrition, is to kind of act as a bridge to kind of get private sector on board and augment the efforts of the government.
Very true.
Right. So a model like the Paripurna project, kind of thrives on being a community-based model, right? That requires the coming together of these individuals and creating something. And now with the COVID pandemic, something like that has kind of come to a halt. So how are you dealing with COVID kind of impacting your community models, and how have you been able to kind of overcome these challenges?
See, it took, COVID has taken us 2 to 3 steps backward, which could be equal to a generation, because the institutional deliveries got impacted because there was a complete lockdown. Traveling was a problem, so again led to home deliveries. Second is, whatever women were able to produce, they were not able to sell it. They also lost their daily wages, because employment, as wage labor, also got impacted. So and then this was after, the shock of demonetization, after the shock of GST, and this was the third shock. So COVID, if you see in isolation, it's not right, at least in Indian context, because they were already recovering from these shocks. And the worst part is that so many schemes that were announced during the COVID period, it takes time for implementation. By the time the scheme should reach the intended beneficiary, and to reach in these tribal areas, the reach in these rural areas is very difficult. So till today, women are still struggling to get the basic benefit of the schemes. Though I hear that the PDS system worked very well in the rural and peri-urban areas, but in the tribal areas, it still remained a challenge, primarily because the villages are scattered, the location is scattered, so they could not even if they were able to supply certain things, the women could not, or the families could not go and avail the free services that were offered during COVID period.
You're right, ma'am. It's important to look at it from the entirety of what has happened over the past few years. And while we have gone a few steps back, now that industries are opening and things are opening up, I think we are going full steam ahead in making a priority again.
I'm sure we will be able to overcome. Yeah.
Now, as somebody who's seen, Deepak Foundation grow from what it was years ago to what it is now, what do you think is the way forward now for the foundation?
See, as you know, that any development activity takes a lot of time to show results, outcome, and it is very important to measure the outcome and the impact. And this cannot be done unless we have data, quantitative data, to be able to convince people. Quantitative data for many of the policymakers make more sense than qualitative data, because they think it's too small and they cannot go in such micro level. When they deal at macro level, they need evidences. And for evidences, it is important to have a very robust monitoring and evaluation system. And also evidence-based research, helps a policy change. So we are focusing a lot on research and development. The second thing, in terms of, we feel that nutrition is a topic which cuts across all sector that the foundation is handling currently. So while we were focusing on women empowerment as a thematic, focus, we realized the underlying thing is, along with livelihood opportunity, women's nutrition and health is equally important. And so we are now focusing a lot on how we can improve the nutrition aspects of women by taking up not only research and evaluation, but also planning innovative ideas that we have piloted, but we need to document it well. So some of the programs that we contemplated and started in a smaller scale was Nutri Garden in different locations. So Nutri Garden was one thing that started with the livelihood program of empowering women to save the cost of cultivation by training them in making vermicompost and chemical-free pesticides so that the cost of cultivation goes down. So here they produce in the small they're marginal farmers. In the small areas, they were producing very good quality vegetables and pulses.
Right.
And we help them sell this, not only sell this, but also save them, also help them in getting into the trap of food insecurity so that they have sufficient. And we also introduce the dietary diversity so that they understand the importance of balanced diet. And I said in the beginning that anemia was the worst enemy of women, and this is one focus that we continue to will have, so that they have local, indigenous, chemical-free products, food products available to help them, help them in preventing food insecurity. So they should have enough food stock at home to remain healthy and not dependent. COVID has taught us that lesson, that self-sufficiency is very important. So this is a focus, and this is what we foresee in near future.
And I think we carry forward from, the Prime Minister's vision of being vocal for local. Be vocal for, the local things that you can grow in your areas and your kitchen gardens. And that was also the theme of our, Rashtriya POSHAN Ma, where we saw a lot of advocacy towards these simple, ideas to make oneself sufficient and one's, own community.
And one thing which is very close to my heart is how to make this community kitchen functional. Because if the community cares for its own, if the community leaders care for their own communities, nobody will go hungry and nobody will become ill, and unhealthy or poor. So this is something which is very close to my heart, that we should have community kitchens to take care of the community needs.
That's a wonderful idea, ma'am. And ma'am, with that, we would like to end our interview today. Thank you so much for being here. It was, I think, a great experience learning from your experience and your ideas about all the different programs that you have. And we look forward to some of Deepak Foundation's innovative programs in the future. And all the best for all your efforts.
Thank you, Yamini. It was great talking to you. And I wish you all the best for the initiative that your team is taking under POSHAN Ma. Thank you so much.
Thank you.